Heart disease is the most common cause of death and continues to be a health disparity for Latinos. We discuss this and more with an AtlantiCare expert on the heart. It's all here on the next Latino Motion. Join us.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics. Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas.
Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. February is Heart Month, and I'm happy to have a heart expert on the show, Dr. Saeed Ashraf. He is an interventionalist cardiologist with AtlantiCare, interventional cardiologist. What does that mean?
Yes, so that means that I trained as a cardiologist, and then I pursued further subspecialization in interventional cardiology, wherein I use catheters. These are tiny tubes that we can put inside the body, and we essentially deliver oftentimes life-saving treatments to patients with heart disease.
So you're usually dealing with people that are already experiencing a heart crisis, so to speak, correct?
Correct. So that's one of the major reasons, major things that I do, and that includes treating people with heart attacks, but it also includes taking care of patients with advanced coronary artery disease who are not responding to medications, and then we try to deliver catheter-based treatments.
And obviously, February, as I mentioned, is Heart Month. You know, being Valentine's Day, people think heart is just love, but it's very vital, right? And in fact, I understand that heart disease is the most common cause of death. Is that true? Yes,
that's true. There's 695,000 people die from it, according to the most recent CDC data. It is the number one cause of death, not just in the United States, but worldwide. And the burden, unfortunately, continues to go up. Year to year, worldwide, the burden's going up. In the US, we've made a significant dent in treating coronary artery disease and reduced the rate of people dying from it by 25% in the last decade. But there's still a lot of work to be done. There's still a lot of disparities in cardiovascular care when it comes to ethnicities, gender.
I understand there is a difference between men and women as far as heart disease is concerned. Yes. What's that difference?
Yeah, so unfortunately, women in this country suffer from heart disease as the number one cause of their death. It's often identified late in their life compared to males. Sometimes the symptoms that they feel are not the classic symptoms that we associate with, say, heart attack. And we have to recognize these symptoms, whether this is from bias in our studies that we've done in the past, or the lack of research that needs that prevails. But this is something that we're coming to terms with, and we're catching up on very quickly.
And you mentioned race as well. I know within the Latino community and African American community, there's also a larger disparity in terms of heart disease. Tell me more about that.
Yes, so definitely I think over 8.2% increase in Latino American population having heart disease compared to non-Hispanic population. So The risk factors that cause heart disease are also higher in the Hispanic population. That includes people with diabetes, obesity, high blood pressure, high cholesterol, smoking. So all these risk factors are also higher. So naturally, if the risk factors are higher in one segment of the community, the outcomes from those risk factors, which is heart disease, is higher as well.
Now, I know that heart disease sometimes may be hereditary, and some of it may have to do with either your environment, the food you eat, et cetera, right? Tell me more about that, some of those causes that lead to people having a greater risk of having heart disease.
Yeah, so in the early 2000s, there was a study conducted called the Inner Heart Study, where we looked at about 52 different countries and tried to identify causes that if somebody used to have a heart attack, what are the risk factors that these patients have? And it was a large study, and we kind of narrowed it down to 9 risk factors. And the most common of these, irrespective of age, race, or where you live, is having high blood pressure, which is not being controlled with medications, having diabetes, which is not well controlled, high cholesterol, smoking. These are the 4 main ones. And then the others that are included are lifestyle risk factors, and that includes how much physical activity do you get, whether you eat fine fruits and vegetables every day, and then family history and those things play a role as well.
I think you touch upon a point that impacts the minority communities, particularly maybe people who are lower in the social economic, in terms of being able to eat healthy food, like fresh vegetables, et cetera. That seems to be also a major issue in terms of the disparity.
Yeah, healthcare disparities, especially when it comes to cardiovascular care, is a very important topic that needs to be identified, especially when it comes to different ethnicities. People of lower socioeconomic class, we know, don't have the same access to healthcare. They don't have the same healthcare literacy that's required. Often, the economics of healthcare prevent them from getting the care that they need. So, all these factors play a role in not receiving the adequate care that they should.
We see in reports where maybe a young athlete dies of a heart attack, et cetera. It seems like you would think that was for older individuals, but it seems to be more common as well in the younger population. Is that correct, or is that just an assumption?
No, I don't think there's any studies that have shown that the rate of athletes dying from heart disease is going up, but I think we just have more exposure, more media, so we tend to learn about these more commonly now. We also have more people performing CPR and performing rescue, so people live, and we are able to perform diagnostic testing to kind of identify the causes of these events occurring, and invariably a lot of them lead to underlying heart issues. But I think in athletes primarily, the etiology is not always, what adults, older people see. It's more hereditary, more family related.
So there is no specific age where a person could develop heart disease, but it is more common as you get older. Is that correct?
Yeah, so coronary artery disease, which is essentially plaques that form in the arteries that supply blood to the heart or to the brain or kidneys or legs, this kind of starts prevailing as people get older. As you reach 60 for males, up to over 22% of males have coronary artery disease. I think for females it's around 12%. And then that number goes well over 35% for males, and I think closer to 20% for females by the time you reach 80. So it is a significant burden on the community, and the prevalence of coronary artery disease is quite significant.
Just going back, because I thought that females were more at risk for heart disease than male. Is that the case, or was it the other way around?
Well, studies have shown that males are at higher risk.
Males are.
But I think there's some data lacking, and I think more studies need to be done.
We want to talk a little bit more. I mean, there's a lot to cover in maintaining your heart healthy. We're going to take a quick break. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. Saeed Ashraf. He is an interventionalist cardiologist with AtlantiCare, and we were talking about February being Heart Month, and it's shocking that heart disease continues to be the most common cause of death. We discussed some of the disparities that exist out there, particularly for Latinos and African Americans, and the difference between men and women. So let's talk a little bit about those risk factors. I mean, I'm sure that you alluded to some of them, but let's explore some of those risk factors a little further.
Yeah, so, I think having a frank discussion with your primary care doctors about asking them, what are my risk factors for coronary artery disease, because that is the #1 disease in the world. And then you can go from there. But if you are somebody who has high blood pressure, or you have high cholesterol, you're diabetic, you're obese or overweight, and if you smoke, unfortunately, then you are at a high risk. So working on those, in controlling those risk factors is going to be the first step. And then what we emphasize a lot is lifestyle changes. And by lifestyle, I mean making sure that you're not sedentary. You're getting up and moving around, not just moving around, but being physically fit. So we recommend at least 150 minutes of exercise in every week. And then eating better foods. And diet plays a very important role in how your heart's going to perform. What you put in your body eventually translates into how your heart's going to perform. It's like an engine of your car. So that's important. And then, there are psychosocial factors as well. Stress is important, controlling stress. Those are primarily the risk factors we focused the most on.
You mentioned stress. That's interesting, because above all these other factors, obviously we all live very busy and many times stressful lives.
Yes.
How important is that to release your stress?
Yeah, it is important. It's definitely a risk factor. And it's difficult to get away from being stressed. I think it's at a baseline, everyone has a level of stress that they have to deal with. What's important and what people can focus on are ways to control it. And whether it's through meditation, some people like prayer, some people like yoga. I encourage people to do anything that helps them sort of feel at peace, and that's usually the best way to target stress.
Yeah, that's great. And when we start talking about symptoms, right, what are some of the things people should look for? And sometimes maybe it may be something that a family member notices that might be different. Tell me more about some of the symptoms that could be displayed as a result of having heart disease.
Yeah, so certainly chest pain is the most common symptom that we allude to when we're thinking about the heart. So chest pain, regardless of how you feel it may be, that's an important sign. If you have risk factors that we discussed just now, then you shouldn't take those lightly either. You should see your primary care doctor, or if you get chest pain, say it's in the middle of your chest, it's pressure-like, radiating to the arm, worse with exercise, gets better when you rest. That's what we call classic angina or typical chest pain. We encourage patients to come in and see us if they experience anything like that. Of course, if somebody's having chest pain that's not going away, that shouldn't be taken lightly. That's a sign of a heart attack, and you should go to the nearest hospital because you may need an urgent intervention to open up a blocked artery. And when such a scenario arises, time is muscle, so we have to be very fast in trying to open up that artery. And so the faster you identify your chest pain and come into the hospital, the faster you get treated and the more your muscle is saved.
Yeah, some people ignore the signs, right,
Yes.
until it's too late. Let's talk about, just backtrack a little bit because you mentioned exercise, 150 minutes?
A week.
I might be 100 minutes short,
Yes.
but tell me.
That's minimum.
Minimum 150 minutes. Should they be seeing a doctor before they start an exercise regimen?
Well, it depends on what age bracket you're in and what your underlying risk factors or underlying comorbidities are. If you have illnesses, then it's best to discuss with your doctor before you decide to do something ambitious. But I encourage patients that I see in the office, if they are able to participate in some level of exercise, whether it's I see a lot of older patients. So, a lot of them have arthritis or have bad joints, replacements, knee replacements done. So they're a little weary about, doing too much exertion. So I encourage them to get membership to a swimming pool, because in a pool, you don't have to exert too much on your joints and you get great cardiovascular exercise there. Otherwise, whether it's simply walking around the block, taking your dog out for a walk, if you have stairs at home, you should try to do them at least once or twice. Avoid the elevator when you're out in public places. So there are ways to be more physically active. The idea is to get started.
Let's just talk a little bit about diet, right? Because obviously you mentioned high blood pressure, et cetera, diabetes. So there's a lot attributed to your diet. Yeah. Tell me more about that impact and changes we can make in our diet.
Yeah, diet is actually, I would probably put that in the forefront of lifestyle changes. Just because we have great data that shows that if you change your diet, you can really lower your chances of having heart attack and stroke. But the diet that's been proven time and time again is the Mediterranean diet. It's not necessarily a low cholesterol diet. What it essentially is a low inflammatory diet. It encourages the use of more extra virgin olive oil in your foods when you cook, using more fruits, vegetables, a lot of nuts in your diet, and legumes. These are things that you can break in half, like beans, lentil, chickpeas, and cutting down on red meats. That's very important. Cutting down on red meats. If you're going to eat poultry, chicken, that's fine. No more than a decacard in size. Eating more fish is definitely healthier.
For Latinos, our diet may not be it's delicious, right? Ajo con gandules, I love, right? But maybe changing that as well, so that you're including these other nutritious food as well in your diet.
Yeah. Actually, I know you say that, but I find that some of the Latino diet is actually quite healthy. If you substitute meats for beans
Right.
and I use a lot of tortilla almost on a daily basis as a form of wrapping. There are ways around it. You just have to. You have to work with your ingredients and
Still
and you
use
can
the
get
tortilla, but put a lot of veggies on it,
there.
right?
Mostly veggies or chickpeas, lentils, beans. There's different ways you can utilize that. Yeah.
So, Dr. AtlantiCare has certainly been in the forefront in terms of treatment for heart disease, and I know you hold regular office hours. Tell us more about your office location.
Yes, I'm in office one day a week, and that's at 318 Chris Gopp Avenue. It's right across the street from the AtlantiCare Hospital, so easy location.
All right, we'll make sure to put that on the bottom of the screen here. We're going to take a quick break. We're going to talk more about those treatment options. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. We continue our discussion with Dr. Saeed Ashraf. He is an interventionalist cardiologist with AtlantiCare. And Doctor, we were talking about the risk factors and some of the symptoms that we need to look for. And obviously, once you make those changes, it could lead to a very healthy life. But if you do have heart disease, you need treatment. Tell me more about it. I know AtlantiCare is an award-winning cardiology care center. Tell me more about the services that are offered at AtlantiCare.
Yeah, so AtlantiCare is, as you know, is the only 24/7 comprehensive cardiac care center in southeastern New Jersey. We have the only cardiac surgery option available to our patients in this region. We have a dedicated cardiac catheterization lab where we perform life-saving coronary interventions. We actually have received 9 separate recognition awards for our cardiology program. The one that I'm most proud of is from the health grades that we got the #1 in the state for coronary interventions. So in terms of patients that need stents or coronary artery work done, we provide that, and we actually take great pride in providing that service because not only that, we're also one of the highest performing centers when it comes to treating patients with heart attacks in the state of New Jersey. So in terms of our experience and the volume that we get, we feel great pride in providing that service.
It's also great to hear that, and in full disclosure, I served on the board for 29 years of AtlantiCare, and seeing that transition to being such a progressive cardiac care institution is so great. And I know that you use a lot of tools, and you mentioned some of the tools at the beginning of the show when you were talking about your position. Tell me, what are the most common treatment options that patients have particularly when they're facing a heart crisis?
Yeah. So if somebody comes in with a heart attack, like we had somebody come in earlier today, time is muscle, and that's heart muscle. It's unlike some of the other muscles in the body, which can regenerate. The heart muscle, if it starts dying, it becomes scar tissue and it does not regenerate. So you lose a lot of heart functioning. And if you lose heart functioning, the other organs start suffering as well. So we work against time in trying to open up blocked arteries. And we do that by using these catheters. These are small tubes that are made out of polyurethane or Teflon, essentially the same material that plastic bags are made out of. And we place them either through the wrist or through the groin, through the arteries, and they travel backwards through the arteries into your heart. And we put them in the arteries that supply blood to the heart, and we're able to pass wires, and over those wires we're able to pass balloons that cross the blockage, and then we inflate those balloons so that the passage reopens. And then we have to put stents in there so that the artery doesn't recoil on itself or new plaques don't form. And that's essentially how we restore blood flow, and we have to do this in a fast manner. It's not always as straightforward as I make it sound. As people get older, have many risk factors, the blockages can be very challenging, but that's where our experience comes into play. We do this a lot, and we feel we give great outcomes to our patients.
So is this done through basically computer, or is it a manual tool that you use? Tell me more about that.
No, it's all manual. We're watching everything's done under an X-ray, and we use contrast. And that's basically dye, the same material that's used in CT scans, to look at these arteries in real time. And as we're performing the procedure, we're doing everything with our hands outside of the body, and that's how it's done.
So you're doing these treatments, obviously, when someone's experiencing a heart emergency. Are there other procedures you use where maybe it's not an emergency but could lead to an emergency? And what would those procedures be? Yeah,
so somebody who has what we just discussed is a heart attack. That's an acute situation where it happens acutely, suddenly. Mm-hmm. Sometimes blockages form, and a lot of times blockages form over a long period of time, and they take time, and they get from 50%, then become 80%, 90%, and then start causing chest pain in these patients. First, we try medications, and if the medications don't work, then we try the same techniques. We try to open these arteries up, open that blockage up, and we use the same technology. We use balloons, stents. Sometimes we have to use other neat devices, such as it's called atherectomy devices. Essentially, we burr through the blockage because it's so severe, and all these neat tools that are available at our disposal. Thankfully, we're at a center where we have access, and we have all these newest gadgets that are available, and we're at the cutting edge of this technology. So we use them in the right setting and take care of our patients.
Now, obviously, this requires a lot of skill. You need experts
Yeah.
to be able to provide this type of care. Tell me a little bit about the type of training that you had to go through and other experts in this field have to go through.
Well, I did 3 years of internal medicine residency, and then I did 3 more years of cardiology fellowship. I became board certified in each of these, and then I also did 1 additional year of interventional cardiology, where the entire year was focused on doing procedures in the heart. Certainly, that is a very rigorous year of training. We work long hours. I personally did over close to 900 procedures in 1 year, and out of which I did around 500 to 600 interventions. And this is all done at New York University, which has some of the leading world experts who trained me. So I'm very grateful. And then once I came here, I joined 3 other colleagues of mine, Dr. Van Hook, Dr. Levitt, and Dr. Kaw, who are much more experienced than me, and they took me under their wings, and they've sort of guided me along, and they've been great mentors. And together, we have a good mix of experience and some of the younger proceduralists, and we all work together in a cohesive manner. And at the end of the day, it's all about the patient on the table, and that's one of the.
And of course, technology is changing all the time, right? And new procedures, new methods. Mm-hmm. How do you stay on top of all the new procedures and new techniques?
Well, we learn. We go to courses, we attend conferences, and that's how we learn what's coming and what's already out there and what other places are doing, and that's how we do that.
What's one of the most important things that we should tell a patient who may be at risk of heart disease?
Not to take it lightly. That early intervention, whether it's through lifestyle changes with medications, or if you need treatment with catheter-based treatments, we can provide that. But not to take it lightly. And your heart's an important organ. Everything else in the body depends on it. And essentially, a heart that's failing means that your world shrinks. People get very short of breath, tired, very fatigued easily.
And it affects your quality of life. But Doctor, thank you so much. This is great information and certainly very appropriate for Heart Month, February. Thank you so much for joining us on the show.
Thank you for having me.
And thank you for joining us once again here on Latino Motion.
Funding for Latino Motion is provided by AtlantiCare. For more information, call 1-888-569-1000 or visit atlanticare.org. Atlantic City Electric, energy for a changing world. And South Jersey Gas. Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on Facebook and YouTube. We encourage your comments and contributions for show topics.